Okay, so balikan natin yung background ng patient safety. So there had been a movement for patient safety in the last few years of the 20th century. So dito, mas binibigyan ng halaga or binigyang pansin yung patient safety dahil sa nakita ng mga tao, particularly yung mga academicians and some other people from the industry, from the industrial sector, that there have been many accidents or unwanted harm or injury na nangyayari sa mga health facilities that time. So this movement nag-umpisa siyempre sa mga first world countries, particularly the United States of America and UK. Okay? So, dahil doon nagkaroon ng public concern about the medical errors na nangyayari sa mga health facilities. Dahil sa pagtaas o paglaki ng public concern, ay nagkaroon ng mga different programs na ang pakay ay mapaganda at mapabuti yung ating patient safety sa lahat ng mga health care facility. So last time, we also discussed the different classification of patient safety. So we have the near miss. So an incident happened but did not reach the patient. The no harm incident number 2. So the incident happened, reached the patient but no discernible harm happened. And harmful incident, siyempre, nangyari yung incident at mayroong injury or harm na nangyari. Okay, so that is the classification of patient safety according to the World Health Organization. Yung harmful incident are further divided into 2, preventable and non-preventable. Adverse event and adverse reaction. So yung adverse reaction, hindi siya naiiwasan, katulad ng allergy to contrast media or allergic reaction to contrast media. So siya ay reaction, hindi siya event. Okay, ano yung mga possible events? Example nito yung fall. So fall ay pwedeng maiwasan. Okay, so reporting a particular incident in the healthcare facility can be seen as central or vital to safety improvement. So malaking bagay ang reporting sa pagkakaroon ng sa pag-unlad o pagsasabago ng patient safety programs. So reporting system fulfill one or more of the 5 main function. So ito yung mga following function. Siyempre, public accountability, response to the patients and families involved. So kung may nangyaring incident, of course, kailangan meron tayong mabibigay na kasagutan sa pasyente at sa kanilang pamilya. Communications alert route. So kung ito ay isang malaking health facility, so malaking scandal, magkaroon ng mga incidents na pwede namang maiwasan. At isa pang side ng communication alert route is yung paano ba yung naging daloy ng communication when reporting. Diba? Isa nga yung sa pina-assignment ko sa inyo yung mechanism or yung pagkakaroon ng flowchart. Paano ba yung process ng reporting an incident? Okay. Then, it is also a barometer of risk within healthcare. So, sa reporting, dahil sa mga incident reports, so nagkakaroon tayo ng sukatan ng mga possible risk within the healthcare facility. And of course, foundation for learning and improvement, which is the very aim of the incident reporting mechanism for patient safety. Na these reports or these incident reports ay naka-aim sa learning and improvement of patient safety. Learning ng mga healthcare workers and improvement of patient safety and other policies na may kaugnayan sa patient safety. Okay. So, however, may nakitang mga weaknesses sa karamihan ng mga reporting systems in healthcare. So, first weakness ay yung tinatawag na underreporting. So, this depends mainly on the prevailing culture and whether incidents are considered as an opportunity to learn or as a basis for enforcing individual accountability and apportioning blame. So, kaya nagkakaroon ng underreporting or hindi nagre-report ng ang mga employee ay sa kadahilanan na karaniwan sa mga healthcare facilities ay ginagamit ito bilang basis for disciplinary action. Diba? Yes, we know that sa bawat action natin as professionals, that kailangan we are mindful of our actions. Diba? We act as healthcare professionals. Alam natin yung mga bagay-bagay na dapat gawin, and therefore we are responsible and accountable to any accident or injury that may happen in our duration of work. However, part of the reporting mechanism, incident reporting mechanism, ay hindi nakafocus doon sa sino ang may gawa, may kasalanan. But it is focused more on how and why the incident happened, not on who. Okay? So later on, malalaman natin kung bakit ang isang magandang incident reporting mechanism ay nakafocus doon sa how and why and not sa who. Okay? So, and one of this reason nga is yung underreporting. Kung ang isang healthcare facility nakafocus doon sa sino ang may kasalanan, syempre as a healthcare worker, i-report mo ba yung sarili mo na ikaw ang may gawa? Unless may nakakitang iba. Hindi ba? it is our instinct na hindi natin ipapahamak yung sarili natin. Pero of course, it is a different story when there are other people involved. Let's say kung ikaw lang naman, so nagagawan mo ng paraan or pwede mong gawan ng paraan, kausapin yung pasyente na ganito na lang gagawin. So, walang report na mangyayari, walang reporting, etc. etc. Okay? Or hindi makakarating sa head mo, immediate superior, so walang incident report na masusulat. Okay, and number 2, sa weaknesses ng karamihan sa mga reporting system or reporting mechanism ay yung volume of report. Okay, sa dami ng reports, okay, each report ay hindi na nasusuri individually. Walang sufficient time, resources, or even people who have the expertise to study the reports. Kasi reporting is not merely done just to be reported, for an incident to be reported. Diba? Ang kinakailangan nga, sabi nga natin, ginagawa yung incident reporting dahil sa kailangan matukoy kung bakit at papaano nangyari ang isang accident sa loob ng healthcare facility. Kung hindi siya mabibigyan ng sapat na panahon, sapat na resources, at even people na may kakayahan na mag-analyze ng mga report na ito, so baliwala rin yung mga incident report. So responding to patient safety incident report. Okay? So, kung titingnan nyo itong pyramid na to, it is from the World Health Organization. Okay? So, pwede natin siyang ma-translate into a flow chart, pataas. Diba? So, incident reported, and then after the incident report was reported, so the report ay kailangan dumaan sa assessment, and then there will be an investigation, and after the investigation, so system insights or the analysis will commence on the data gathered. Then after the analysis, so magkakaroon ng formulation ng action plan. Okay, what is the use of the action plan? Action plan in order to prevent future harm. Okay, so yan yung flow chart ng patient reporting mechanism. As a general form proposed by the World Health Organization. Okay, this one naman is the conceptual framework for the international classification for patient safety. So, yan. Kung titingnan natin, marami siyang items na included. Okay? Influences, informs, then contributing factors or hazard, a patient characteristic, incident characteristic, okay, and then magiging, pag pinagsama siya, kasama yung contributing factor, malalaman natin kung anong klaseng incident or accident yung nangyari. Okay? And then paano siya na-detect? Ano yung influence for detection? And after detection, ano yung information na makukuha in order for us to have an action taken. Okay? So basically, ito ay paikot-ikot lang to, halos parang cycle lang itong framework na ito. Okay? So action taken to reduce risk. Okay, yung nasa gilid. Okay, so yan. So basically, yung mga nandyan, mga factors yan that are taken or can be used in creating their own classification for patient safety or incident reporting mechanism. Okay? So ano yan? Generic. Okay. So, a positive environment for reporting. So, kinakailangan sa isang healthcare facility ay mayroong positive environment for reporting. Ano ibig sabihin ng positive environment for reporting? So, ibig sabihin that in your workplace or in this healthcare facility, reports are encouraged and valued. Okay? So, ina-encourage lahat ng empleyado na mag-report ng any incident that happens to the inside the facility. And itong mga reports na to ay binibigyan ng halaga, pinag-aaralan. Okay? And staff are praised for participating. Okay? Kung hindi man praised, at least they are recognized for participating in the reporting mechanism. Okay? And then, education and training have equipped staff with an understanding about how systems fail and how harms occurs in healthcare, and also how the impact of both can be reduced. Okay, so, hindi lang nagtatapos sa reporting ang responsibility ng mga staff. Of course, the employer or the healthcare facility administration will have to invest in the education and training of the staff. Kaya nga, inuna natin i-discuss yung overview about occupational health and safety. Okay? Dahil sa binigyan na may training na ang staff sa occupational health and safety, therefore they will be more aware on the different kinds of hazards, risk, or injury na pwede nila makuha or pwedeng mangyari in their work. At the same time, pwede rin mangyari sa pasyente na nandoon din sa kanilang or sa ating workplace. Okay? And of course, itong mga training na ito ay hindi lang para maintindihan yung mga risk. Kung hindi, tinuturo rin dito how to have a critical thinking skills in order to prevent or avoid or reduce these accidents. Okay. So of course, walang positive environment where there is an atmosphere of blame and retribution. Diba? Kung ang punteriya ng reporting ay sino or yung who, Diba? Reporting and learning will not flourish. At dahil sa itong reporting ay mawawalang saysay or hindi mangyayari or hindi maikakasatuparan yung reporting mechanism, no, so lalong mapuput in danger or at risk yung ating mga pasyente. Bakit? Kasi yung mga mistakes, errors will not be admitted. Hindi aaminin ng mga staff na nagkakamali. Okay? So example na lang yan sa ating department, yung repeat exposure, repeat examination. So madaling itago yun. Diba? Kasi solo ka lang naman pag nag-x-ray. Unless you need help sa pasyente, pagagalawin yung pasyente, bubuhatin. So, usually dalawa kayong rad tech na magtutulong sa exposure. Okay? Next is the identification and recordings of incident. So, ito na yung umpisa ng incident reporting. So, identification and recording of incident. So, it is equivalent to the reporting of incident. It is important that staff are absolutely clear as to what constitute an incident. So, dapat may policy ang healthcare institution kung ano-ano ba yung mga instances or situation na pasok doon sa tinatawag na incident. Okay? Para malinaw kung ano lang yung gagawa ng report. So, therefore, kailangan mayroong malinaw na policy. So, identifying and recording that an incident has occurred is the very first step in reporting and learning process. So, katulad ng sinabi natin kanina, so it is the first step in the incident reporting mechanism. So, yan. So, importante itong kasunod. Most reporting systems have a clear policy on whether reports are made voluntarily or mandatory. Okay, so ito yung dapat nating malaman sa isang or kapag tayo ay nasa isang healthcare facility. Okay? Ano ba yung mga incidents na kailangan mong i-report mandatory at yung mga incident na voluntarily mo lang i-report or hindi mo kailangan i-report pero sa tingin mo ay dapat i-report. Voluntary yon. Pero may mga incident na kailangan mong i-report. Okay, example ng mandatory reporting. Okay. Use needle. Na-prick ikaw or na-prick yung pasyente na isang used needle. Accidental pricking ng used syringe needle. Okay? That is yan ay kabilang sa mandatory reporting. Bakit? Okay. Kapag ang isang tao ay na-accidentally needle prick na isang syringe used or unsure tayo na used ba siya o hindi, kailangan siya ay mai-report. Kailangan gawa ng incident report. Why? Because the patient or the person na na-prick, accidentally prick ay kailangan sumailalim sa different laboratory tests to make sure na walang harm na pwedeng mangyari sa pasyente. Ano yung mga laboratory test na kailangan gawin sa pasyente? Actually, napakadami. HIV test, HEPA profile, HEPA A, B, C, D, F, G. Okay. Then, mga STIs. Okay. Ano pa? Other blood-borne diseases. Okay. Okay. So, yun ay mandatory. Okay. Ano naman yung mga involuntary? Voluntary. So, voluntary katulad nung repeat exposure sa atin. Okay, or double exposure. Or yung mga wrong exposure of body part. Nag-expose ka, wala palang film. Yun, voluntary lang yun. Na-reporting yun. Okay? So, in continuation, the recording or capturing of information about the incidents usually takes place in one of the four ways or four main ways. So, ano ba itong mga to? Okay? First, on a paper reporting form. Okay? With or without addition of later documentation. So, alam na natin yung term na documentation. When we say documentation, pictures. Normally, pictures ang documentation. Okay? Pero other form of documentation ay ito, reporting. Reports. Incident report, documentation yan. Okay? Or part ng documentation. Okay? On a paper reporting form with information subsequently transferred by a data clerk to an electronic record. So meaning the incident report ay nasa electronic platform na. Then third, directly by the reporter into an electronic record. So directly na ni-report nung reporter, siya na mismo yung nag-encode sa electronic platform. Okay? And into electronic record after follow-up work that may involve further information gathering or investigation before data entry. Okay? So bago siya ipinasok sa electronic platform, ay nag-undergo na ng further information gathering and investigation. Okay? So in addition, ito mga information na to ay may tatlong domains. Okay. Kailangan itong mga incident recordings or report na ito ay may ganitong katangian. Description. Anong nangyari? What happened? Including patient characteristics, incident characteristics, and location. Example ng patient characteristics. So, let's say, ang patient ba ay nasa bed? Nakahiga ba siya? Ano orientation ng pasyente? Droggy ba siya? Conscious ba siya? Okay? Not conscious ba siya? Unconscious ba siya? So, yung mga ganon. Okay? Incident characteristic. So, let's say, pati yung location. Basa ba yung sahig? Mainit ba? Mataas ba humidity? So, mga ganyan. Etc. Maliwanag ba? Madilim? Okay? So, description. Then, followed by explanation. Why it happened? Bakit? Okay? Ano yung mga possible uh, causes? Okay? Ano yung mga contributing factors at mga mitigating factors kung bakit nangyari yung incident? Okay? Then, the remedial measures. What actions are taken as a result of the incident? Meron bang ginawang actions? Let's say, nagkaroon ng uh, mga seminars for the staff who caused errors, or ayan, nagkaroon ng review ng processes, okay, ng procedures, nagkaroon ng redesigning ng isang particular facility or particular room, okay, nagkaroon ng organizational changes or nagkaroon ng reshuffle sa staff. Yan. So, yan yung mga remedial measures. Okay, so these are the uses of incident reports. To formulate action to prevent or reduce the risk of a similar incident in the healthcare setting where it occurred. Okay? So yun naman lagi ang aim ng reporting mechanism, okay? To prevent future harm. Okay? Then, to communicate information that could lead to the prevention of similar incident elsewhere in a country's health system or globally. Okay? So, usually, ito yung mga merong reporting system na computerized at they send data to a particular agency na kung saan ang ginagawa ng agency na to ay nagkakandak ng studies or researches about the uh, patient safety and incident monitoring. Then, to aggregate with other reports to produce larger volumes of data capable of providing maximum possible understanding of the problems in the system that lead to the harm or risk of harm. So yun nga, katulad ng sinabi natin, nagpapadala sa isang server ng mga information. Aggregate. Okay. Aggregate ay nagiging composition ng ibang report kasama ng ibang report to produce a larger data of information. Then, of course, for education and training, for research, development, and improvement, and for public reporting and accountability. And lastly, for open disclosure to patients and family. Of course, hindi natin kakalimutan na involve yung patient and their families. Okay? So, kailangan magkaroon ng disclosure on what happened to a particular incident that involves the patient and their family. Okay, so for my question ba? My question? Okay, let us continue. So after the report have been submitted, okay, the report will undergo an assessment or review and investigation. Okay. So in this step, understanding why and how an incident happens involves establishing why and how errors happens within the context of complex systems and what part of human behavior plays in this process. Okay. When we say systems, okay, so system has been defined as an interacting combination at any level of complexities of people, materials, tools, machines, software, facilities, and procedures designed for to work together for a common purpose. Okay? So, pwedeng isa dyan, yung dahilan kung papaano at bakit nangyari ang isang particular na error. Okay? So, dyan yung reason kung bakit may review and investigation. Okay. So, ways to understand and engage with systemic risk. So, ano ba yung mga ways na ito? Kailangan titingnan daw natin yung defenses. Ano ba yung mga defenses na sinasabi? At syempre, titingnan din natin yung mga causes, yung mga possible na dahilan. At, of course, yung interaction ng defenses and causes. Or interaction of within the system. Of the people involved, of the materials, of the tools, of machines, softwares, any part of the system. When an adverse event occurs, the important issue is not who blundered or kung sino yung may kasalanan, but how and why the defenses failed. Okay? So yan yung dapat natin laging tatandaan when we are making a report. So hindi yan nakafocus sa kung sino ang may kasalanan. Okay? At the same time, kung tayo naman yung immediate superior, okay, we must know that a report does not focus on who blunders, but on how and why a particular system fails. Okay? So tatandaan natin yan. So, 3 ways to understand. So yan nga yung kanina natin sinabi. Okay? So defense, the weaknesses in defenses, latent failures, or unseen deficiencies within a complex system can result in an accident. Okay. So yan nga. Yeah, so tingnan natin yung Swiss cheese model. It is a system weaknesses and defenses. So ito ay based on the theory of reason. Okay? So kung makikita natin, there are several slices of cheese, Swiss cheese. Okay? So these slices of cheese are equivalent to layers of defenses. Okay? Okay. And each layer of defenses ay may mga butas. Diba? Ano itong mga butas na to? According to the model, some holes due to active failures. Okay? Other holes naman due to conditions. may kinalaman sa conditions. Either environment yan, okay? Or possible hazard. Yun. Okay, so yung hazard na nandun sa likod, pwede pag siya ay diretso palampas ng mga defenses, layer of defenses, ay magkakaroon ng accident. At dahil nga may mga butas na pwedeng daanan ng hazard, so it leads to the accident. And ito yung tinatawag na system weaknesses and defenses. So may defenses ka nga, pero each defense mo ay mayroong mga deficiency, may mga butas, may mga weakness. At itong mga deficiency na to, itong mga butas na to, ito yung kailangan mong bigyan pansin in order for the defenses to work properly, to serve their purpose. At ano yung purpose nila? To prevent and avoid injury or accident. Okay, so yun yung reason ng mga defenses na ito. Okay? Clear ba? Malinaw ba? May question? Okay? So, after learning what defenses are all about, so we must identify the possible causes. So accidents and incidents can be examined across a wide field to build up a list of antecedents or contributory factors to an error that should be looked in for an investigation. So ito yung mga possible cause. So may kinalaman sa individual operator or the employee mismo. Okay? Kung multiple operator, so yung buong team, pwede sa organization ng team, may cause kung bakit nangyari yung isang particular accident or incident, or sa machine, sa equipment, okay? Sa management, okay? Sa regulator, okay? So when we say regulator, ito ay isang agency na nagre-regulate ng mga let's say particular practices or particular machines. Okay, let's say hindi nag-visit yung regulator natin. Sino ba yung regulator natin for us to operate a radiological facility? Of course, the Center for Device Regulation, Radiation Health and Research. So normally, sila ay annually bumibisita sa mga X-ray facility. Kine-check nila yung mga documentary records ng healthcare facility. Kine-check din nila yung mismong machine. Tinitingnan nila kung tama yung beam alignment. Okay? Kine-check din nila yung chemicals kung meron. Kung hindi naman chemicals, yung computer, kine-check nila. Okay? Kine-check din nila yung mga different parts ng X-ray, okay, na X-ray machine. So yun yung regulator. Okay? Sa equipment, kung hindi siya nagkakaroon ng preventive maintenance, so maaaring magdulot ng accident. Okay, so organization and management. So let's say nagkaroon ng convention sa Baguio. Okay? So merong 10 RadTech sa department. Ang ipinadala na RadTech sa Baguio ay let's say 6. So, 4 lang matitira sa department. Okay? And during the duration of the convention, may nangyaring hindi maganda, let's say, may nagreklamong pasyente kasi uh, hindi siya agad na nagawa yung procedure. Hindi agad nagawa yung procedure. Reason, lack of manpower. Okay? So, may kinalaman sa management. Okay. And sa health sector, sabi dito, in order for us to determine the causes, so we use the technique of root cause analysis. And this had been called the gold standard in investigation for in healthcare facilities. Kaya again, root cause analysis. So ano yung root cause analysis? So, tinutuntun dito kung ano ba talaga yung pinakaugat na dahilan kung bakit nangyari ang isang bagay. At ito ay i-analyze ng matindi ano yung dahilan, bakit nangyari, ano yung mga involved na factors, kung paano ito nangyari, etc. Root cause analysis. Okay. Then, of course, after we hear the weaknesses or the defenses, the causes, of course, the interactions. So, incidents and accidents in complex systems are seen to result from more than one, usually multiple antecedents that interact in a complex way. So, nabanggit na nga natin kanina na itong mga incident and accident ay nangyayari sa loob ng isang complex system. And a system ay binubuo ng different elements such as the machine, the employee, the materials, okay, the environment, etc. Okay? And itong mga elements na to, they interact with each other. And this interaction, okay, maaring may mangyaring error that can cause incident or accident. So, assessment of patient safety, incident report. So, ito yung parang pinaka-summary lang. Okay, review individually. So, each accident or incident should be reviewed individually. Study in aggregate, pagsama-samahin lahat ng possible studies, information, data na nagather. And then, investigate fully. Tingnan lahat ng bagay na maaaring may kinalaman sa nangyaring incident. So, patients and families should be provided with support and care after an event. Diba? Hindi natin dapat pabayaan yung pasyente kung may mangyaring adverse reaction. Diba? Kapag nag-administer tayo ng contrast media, okay, nagkaroon ng adverse reaction sa pasyente, hindi agad-agad natin pinapauwi ang pasyente. No? Anong ginagawa natin? Okay, minomonitor natin ang pasyente in case that there would be a possible anaphylactic shock na mangyari. Pero, syempre, hindi natin paabutin sa condition na gano'n, sa state na gano'n. Okay? So, usually, the doctor or the radiology nurse will administer, upon the order of the doctor, an antihistamine. Okay? So, usually siya ay by IV, yung antihistamine. Okay? Or let's say, hindi siya allergic reaction, nagkaroon ng extravasation. Of course, hindi natin pababayaan ang pasyente. So, the rad tech or the radiology nurse will assist the patient in order for the patient to excrete the liquid that are confined in the interstitial tissues. Okay? So, para mawala yung manas, okay, gagawa ng mga intervention such as hot compress, okay, and kung hindi kaya ng hot compress, elevation ng extremity. Kung hindi pa rin kaya ng elevation ng extremity, and saka na mag-administer ng diuretic. Okay? Pero that is upon doctor's order. Okay? Staff involved in serious incidents should receive counseling and support in the aftermath of the events that led to harm. Okay, so kung makikita nyo, diba, counseling and support, hindi sinabing punishment. Okay, so katulad nga ng paulit-ulit natin sinasabi kanina, that the goal of the incident monitoring mechanism is not punitive, but for learning, educational learning, at the same time, improvement of patient safety policy or practices. A systemic insight from aggregated incident data or analysis of data. Okay? So, analysis of data, so basically we are looking for the hows and the whys of the incident. Okay? We identify risks, hazards, okay? And of course, possible solution to the problem also. Okay? So, we also use analysis to probe apparent deviation from the ideal practice. Diba? We learn ideal practice or we learn the ideal from the books in patient safety. Tinuturo yan sa school. And yan ay nakasulat sa ating book. Pero, pagdating natin sa practice, iba yung nakikita natin. Diba? Because there are deviations from the ideal practice. Bakit may deviation? Okay? There are many factors that can be considered why there have been deviation from the ideal practice to the actual clinical practice or clinical scenario in patient safety. Diba? Kasi let's say, yung ideal ay nakabase sa US. Diba? Let's say sa atin, ano ba yung ideal? Okay? Sabi sa ating patient care management, pag tayo ay mag-x-ray ng bata, uncooperative, ano ang gagamitin natin na equipment? So meron tayong tinatawag na pigostat, di ba? Nakakita na ba kayo ng ospital sa Pilipinas na may pigostat? Wala. Walang ospital sa Pilipinas ang may pigostat. Kahit ang pinaka malalaking ospital, walang pigostat na equipment. Okay? Bakit kasi? Unang-una, hindi siya nare-require ng ating regulatory body, ng mga regulatory bodies. Pangalawa, siyempre siya ay additional cost. Additional cost sa mga healthcare facility. Okay? So, pangatlo, there are other improvised ways na ginagawa ang mga RadTech. Siyempre, kung na-improvise ang logic dyan ng mga administrator, kung nagagawa naman pala ng paraan ng mga RadTech, eh bakit pa ako gagastos? So, gagastusin ko na lang siya sa ibang bagay. So, yun. Then, establish procedures to review aggregated patient safety incident report. Okay. Dahil sa analysis ng data, ng mga incident data, so, pwedeng magkaroon ng development, okay? Magkaroon ng policy, ng procedures on how to identify new sources of harm. Okay. So especially those na may impact sa patients. Okay. So dito naman ang focus natin is patient safety. Okay, not more on the workers but on the patients. Okay. So now we move after the analysis of the data. Okay, anong next? So, syempre yung action plan. Okay, learning formulation or formulating action and managing change. Okay, so learning, ano yung natutunan natin sa analysis, then magkakaroon tayo ng formulation ng possible action plan. Of course, if the action plan ay sinuggest na kailangan magkaroon ng changes to a particular procedure or policy, so how would we manage the change in that policy or procedure? Okay. So staff should understand that devising a solution to reduce risk or the likelihood of recurrence, paulit-ulit na incident, okay, is a complex task requiring extensive discussion and expert advice. So, ang ibig lang sabihin dito na dapat maintindihan natin as healthcare workers or healthcare professionals na ang pagbibigay ng solusyon para mapababa yung risk, okay, na isang incident or accident ay kinakailangan ng tulong ng lahat ng expert. Okay? Hindi lang mga healthcare workers ang pwedeng involved dyan. Pwede rin yung mga engineers. Okay? Let's say sa designing ng particular room or design ng isang particular na section. So, an engineer or architect can be part of the expert advice or advisory group. Okay? And sa ating department, hindi lang architect engineer ang involved, kundi pati medical physicists. Okay? Then, actions should be based on the principle that technical interventions and their implementation are two distinct, two interrelated processes. So, ano ibig sabihin? Okay. Simple lang ibig sabihin. Ibig sabihin na yung action daw ay manggagaling or base sa mga technical intervention. Ano itong mga technical intervention na to? When we say technical intervention, they are specific, evidence-based procedures or technologies na pwedeng hatid ng improvement sa isang particular na system or sa isang particular na policy or procedure. However, gaano man ka-perfect yung technical intervention, gaano man siya ka-specific, gaano man siya ka-efficient or effective, nakadepende pa rin yung kanyang success sa implementation. Sa implementation. Bakit? Sino ba mag-i-implement? Ang mag-i-implement yan yung mga tao na nasa low level of management. Yung immediate supervisor sa yung mga workers. And usually, sila ay part ng social system sa low level of management. At magiging successful lang yung implementation nito mga technical intervention kapag nasa mabuting kalagayan yung kanilang social system. Yung kanilang leader ay open-minded doon sa pinapasok na change, na implement na change. At the same time, itong leader na to, kaya niyang i-influence yung kanyang mga subordinates to follow the change. Diba? Bakit? Mahirap ba na i-follow ang change? Mahirap bang sumunod kapag may pagbabago? The answer is yes. Diba? Most of the time, we do not accept the change immediately. Diba? We only accept the changes o yung mga pagbabago kapag unti-unti natin nakikita or nare-realize yung effect nitong mga changes na to. Pero we don't accept changes on day one. Diba? So yan yung ibig sabihin ng actions are based on technical intervention and their implementation. So, patient safety alerts, warnings, and advisory notices should be appropriately designed and piloted, and their communication targeted well. So ito naman, may kinalaman sa mga designs ng mga signages. Kaya sa atin, may standard size yung ating trefoil. Hindi siya basta-basta trefoil lang tapos kinabit sa pintuan ng X-ray room. May standard size, may sukat yun. Sinusukat yun ng nag-check from the CBRRM. Then, ano pa? Yung iba pang label sa pintuan ng X-ray room. Ano yung nakalagay? Yung pag pregnant ay kailangan magsabi sa RadTech. Saka ano pa yung mga usually nakalagay sa pintuan ng X-ray room? Yung don't enter when the red light is on. So madali siya intindihin, di ba? Pero there are other safety warnings or advisory na mahaba. So dapat siya ay concise lang. Madaling maintindihan ng makakabasa dito. At dapat sigurado tayo na ito ay design para sa mga target na population such as patients. Alam naman na gumamit ka ng patient safety alerts tapos ang mga gamit mong words ay very technical. Diba? Siyempre hindi siya maiintindihan ng mga pasyente. So that ends our discussion for today. So do you have questions that you would like to answer, for me to answer? You can ask your questions now.